Yes, sir.
My screen is visible to all of you. This was
Yes,
the last slide we had seen when I stopped at the Lachesis number 2. These people have a lot of energy and are in for all challenges. They want to take all the challenges and competition. They don't mind facing opposition, and heavy discussions are fuel for their fighting spirit. They have enormous energy and they have enormous way of analyzing things. They have enormous way of expressing their views very clearly, very strongly, very powerfully. It may hurt others, they don't mind. But once they want to express, they would express. They don't, even without intending to hurt others, the way the language they speak hurts everyone. So that is the one side of Lachesis. They like to try out their all barriers. Anyhow, this is a rare symptom. A Lachesis patient can sleep from 16 hours to 20 hours. See that? But this is a rare condition. Right? Please try to enjoy and try to find out the patient, our Lachesis drug in this.
तू अपनी मनमानी से बाज नहीं आएगी।
सुलेमान साहब,
Absolutely gorgeous. Thank you. Hello, Firoza.
How she's pretty and
मैंने
she
सुना तुम
wants
दोनों
to be
स्विट्जरलैंड पढ़ने जा रहे हो?
outstanding in the
Lucky
company.
girls.
Attention.
She wants appreciation and her moods are off. And she, immediately she can change. She can be emotional. She can be possessive.
मैं कल अब्बू से माफी मांग लूंगी.
And she can be very, very normal, down to earth. You see that. She is apologizing to the father for her yesterday's behavior.
अब मैं दोस्तों
मेरा बच्चा, मेरी अपनी जान से प्यारा बच्चा.
Possessiveness.
सुनाए जिनकी आंखें करीब
मोहब्बत हमसे करते हैं और रातें वहां गुजारते हैं. मैं औरों जैसे क्यों बनूं? मेरी भी कोई अपनी पहचान है.
I want to be independent.
घनघोर की रस्म में मेरे साथ अछूत जैसा बर्ताव क्यों किया गया?
जुबी राजमहल की रस्मों का अपना कुछ रखा.
ये कबूलने को तैयार नहीं. ऊपर से ये बेहुदा रस्में.
जुबी,
शायद हम सिर्फ मर के ही खुश रह सकते हैं. अब के हम बिछड़े तो शायद कभी ख्वाबों में मिले.
Her anger and all that, she ends up in killing herself and her husband. That is the real character of a Lachesis to the highest extreme. So this was from film Zubaydah, and Karishma Kapoor was the heroine. Very fearful and suspicious. Relationships usually are possessive and protective. Emotional outbursts and often jealousy. If you can just see the film, you can understand many more features of the Lachesis patient. Speech is very important. Passionate, fascinating speakers who can stumble over their own waterfall of words. They are wonderful speakers. If you see the positive side of a Lachesis patient, they can impress any number of audience, any people, any type of people. On each situation, they can speak. They have that capacity. They like power and social position at the top. They want to be always at the top. They want attraction. They want people to see them. They want people to come and talk to them first. And they want to be on some high top positions. They want importance in every occasion where they are. Mentally, they are practical, realistic, quick-witted, intelligent, and critical. See, if you can really understand the dialogues, she can pass on any remark. They don't mind. They are sharp and sarcastic and insulting without really intending to insult. You see, they may not like to insult person, but the way they speak, the sarcasm they use, can be insulting. There is another internal war going on, the fight between the spiritual part in search of higher personal development and their sensuality. Here also you have seen that these people can be very highly spiritual, and at the same time they can be highly sensual also. Now, in all these things, earlier also we have dealt so many symptoms of Lachesis. Many of us know that. All of us are practitioners. They have treated a lot of cases. When so many angles of Lachesis are there, how to remember the multifaceted drug, and maybe very simple things, how, at least main things, how we can remember. Now, today is Shivratri, so I'm showing this. Now, see, keep in the further few slides, keep the religion part away. Just take up what I'm talking on the characters of this Shiva. Okay. In mythology or Indian, history, Puranas, we have a lot of things where snakes are involved with almost all gods. Now, this is the Shiva and Vishnu in one position, lying position, only one of its kind. It is found in the Nepal. Now, this, I don't know how many of you can make out this figure, this person. He is none other than Patanjali, the yoga guru. He is supposed to be half snake and half man. And he wrote the maximum number of yogic philosophy, yogic methods. Patanjali Yoga Sutra is written by him, and he is a man of half snake, half person. And this is the famous Parshvanath of Jain followers. Gautam Buddha is shown there. Somebody sent me this, so I am presenting here this also. Now, Lord Shiva, the ideal picture for Lachesis. How we can remember on the some characters of Lord Shiva, how we can remember or correlate with the Lachesis. Now you see, I have shown you earlier in the first of May, this Amrit Manthan. This is in Jakarta airport, it is given there. During the churning of the milk, what as per the story goes, history goes, a lot of poison came out because they used the snake as a rope tied on the mountain and pulling here and there, so that the snake could not hold it, this thing, and it went on leaving a lot of poisonous air, which could destroy the whole existence. This is what the story says. At that time, Lord Shiva agreed to drink the entire venom secreted by that snake. And he volunteered to save the world. While he was swallowing the entire poison, it was going and it is going to harm him. So that Parvati, his wife, stopped it at the neck. And that's why it became blue. And that's the reason Shiva has another name, Neelakantha, which means blue throat. And that's why we see a lot of symptoms of Lachesis in the neck and in the throat. It can be hypothyroidism, it can be hyperthyroidism, it can be pharyngitis, laryngitis, and cancer, vocal cords problem. All these things are found in that. And you see, the neck is so sensitive that even the snake that is shown in the form of for the Shiva is loose, and the neck, what we are wearing open neck, is a sign of that, where herring for the whole of his life couldn't tolerate anything tight around his neck. Earlier, if you see the old English films or English characters, they show always with a closed collar. But after this proving of Lachesis, Dr. Herring could not tolerate anything around his neck for his lifetime. And so we got the open collars. We are wearing open collars. Now, there is a particular sensation that something, when you swallow, something goes down and comes back. Maybe we can relate it to the same thing, poison, which is stuck in the throat, and when you swallow, it goes down and comes back. The point of showing this poison stuck in the throat is to remember the symptom, that it's a very typical symptom in Lachesis. When the patient swallows, empty swallowing also, something goes down and comes back and stucks. It's a very, very peculiar symptom of Lachesis drug. Now, burning in throat wants cold drinks for relief. This is the common thing of Lachesis, because entire body, entire thing is burning. So he wants always cold things for relief. Always there is a snake around the neck, which is loose and moving here and there. That's what to show that nothing tight can be worn around the neck. This symptom, we can take it like that. Now, here just some information. Lord Krishna, when he was born, he was very, very fair. But the moment he was born, he was taken out of the jail to some other place, for safe place. At that time, the father, Vasudev, has to go through a river, and in that heavy rain, there was heavy rain. So a snake came out of this thing, and which protected the Krishna. But at the same time, the snake was leaving its breath. And because he's a young, just born baby, so entire thing he was absorbing. And there is a history that Krishna, killed one very powerful snake called as Kaliya Mardan. In that way he killed, and the snake left a lot of poison on him. This made Krishna black or dark. And the word Krishna means deep blue or dark color is called as Krishna. This is just for information. Now you see that Shiva is shown with half man and half lady. That means the feminine part and the masculine part. The feminine part is always on the left side. So it has more symptoms on the left side, and its affinity for left side is much more. And also, if you take the Shiva, it's called Shiva and Shakti. Shakti is the active part where everything happens. Shiva is supposed to be just calm and quiet, just be there. The activity of a human being, anybody, is from the feminine side. Parvati, the Shakti, is always on the left side, being the emotional side. Because we also know that ladies are more emotional when compared to men, or they express their emotions much more when compared to males. Now, all complaints are predominant on the left side. Yes, this is what it is. Shiva is always depicted in blue color. So any affections, any disease, any problem which is blue in color, will take up gangrene, will take up some eczema, will take up some eruptions, any condition which is dark blue in color. So one of the drugs, or very strong drugs, are Lachesis. We also have arsenic al. We need to differentiate with both the things. And here, the simple difference is arsenic al, if there is burning and all that, it is better by warm, whereas Lachesis is burning better by cold things. The poison generated when the Shiva drank, it is supposed the poison generated so much of energy and heat, the whole body feels burning. So Lachesis is one of the remedy for burning. Hence, Shiva doesn't have any attire except ash and lion skin loosely tied. So we see the picture of a Shiva, Lord Shiva, Bhagwan Shiva. He will not have any clothes on his body, and it is smeared with the ash, again to cool down the body. And lion skin, which he wears around, and that is also very loosely. So that is the reason he's called as Digambar. Digambar means having no clothes, and the other meaning is something else that will not talk about that. So hence Shiva is supposed to wear minimum clothes because of burning. And along with that, he brings down the Ganga and holds it on his head. Ganga is again water, again to keep the head cool, to reduce the amount of heat that the poison has generated in his body. On the top of that, you have seen many times Wherever there is a Shiv Ling, people keep on dropping waters. He is called as Abhishek Priya. That means again, there is a lot of heat in the body and they want cool water to cool down their heat. And where does he stay? He's supposed to stay in Himalayas, which is itself full of snow, again cold. This all depicts the amount of heat that is generated in Lachesis patients. And above all this, he holds the moon on his head. Moon is again a depiction of coldness, calmness, sereneness. Sometimes the heat is so much, he does Tandav to release it. To release the heat, he dances so much that his heat is released. And that's why he's called as Nataraja. That means Lachesis patient is full of activity. They can do violent actions also. They can do dancing for at least, some dancers are there who have danced for 14 hours, 15 hours. And there is one dancer, I'm not remembering her name. She danced for 48 hours, means 2 days continuously. So anyhow, that is to show the amount of heat that is in the body of a Lachesis patient. Lachesis patient generally full of life and activity cannot keep still. You have seen in that film also. And these people generally are extroverts. A Lachesis patient or most of the snakes are extrovert, and Lachesis is much more extrovert. They would like to mix up in a party, they go, they make their presence felt, they talk to people, they ask their welfare, all those things, so that they want that their presence should be felt in the people and the public. Now, generally, Shiva is quite calm, peaceful, and serene in his own self and meditating. So also, Lachesis patient can also be calm, quiet, without disturbing, doing their own job. They can, in spite of being extrovert, they can also have this side of their picture. Slightest thing can provoke them. A Lachesis patient can be provoked by slightest thing. When excited, he dances, which shows his restlessness, and it takes a lot of persuasion to calm him down. When a Lachesis patient is excited, when he's disturbed, when he's provoked, then he or she can be very, very violent, very restlessness, and everything is exhibited, and it takes a lot of time, lot of thing to pursue him down and make him calm down. And all the anger and energy stored and pent up feelings are released. When they become violent, they discharge, they shout, they talk, everything. And after that, they feel happy. So that in Lachesis, we have a very powerful symptom, very first grade symptom is discharges absurate. So the pent up anger, the pent up stored energy has to be released by severe activity. So we can take down as discharges annual rate correlates to this type of feature of Shiva. Now this is just to depict the anger and the way Shiva does Tandav Nritya. Now the anger in him is so strong and violent that he destroys everything around by opening his third eye, where the whole energy and fire is stored. Now this we can take it in the depiction that a Lachesis patient, if he is excited, if he is provoked, if he goes beyond the limits, he or she can finish the person in front of him, can spoil the whole atmosphere, can do a lot of harm, including killing themselves. And that is what is depicted in the last film what I showed you. The heroine takes the lover and goes and does all that, and ultimately both of them die because of her powerful way of taking revenge or asserting themselves. This is how Lachesis hold vengeance. And when excited, she shows violence and spits venom very revengefully. Generally, Lord Shiva is depicted with destruction. Though it acts on all the three miasms, the dominant miasm is syphilitic in Lachesis. And that's why we see all the destruction, necrosis, discharges are black, offensive, membranous, dysmenorrhea, all syphilitic symptoms. the whole Adhyatma revolves around the Lord Shiva. Means any spirituality in the eastern side, in Indian side, revolves around the Bhagwan Shiva. Lachesis people can become great saints. If they take the other side, they can become really great saints and be calm and always be in their own world. Two wills. Will he become a saint or a fanatic terrorist? This is manifestation of religious mania. They can become very powerful saints or they can be fanatic terrorists. So all this, because in the name of religion, they can do anything wrong. Now, this is a child who cries so violently. We remember Camilla. He can be so irritating, very violent, because nothing in Lachesis is calm and quiet. Everything is violent. Now, we'll take a few cases not treated by me, by our senior authorities in the homeopathic field. Pharyngitis. A woman of 53 years called in January when she was scarcely able to go outdoors, suffering with a sore throat, which she had for 6 weeks. She was under the treatment of allopathy old school, January 20. Had grippe, that is flu, 6 weeks ago. Pharynx soreness since then, better and was sometimes coming down, sometimes going up. Began on left and extended to the right side. This was the symptom. Swallowing solids was aggravating and warm liquids were ameliorating. Now this symptom you can see, take it. This is opposite of Lachesis, but this symptom is present here. Externally swollen enormously and were very, very red. Voice and hearing lost because of the pharyngitis. Larynx and side of neck pain with a dry hacking cough. No rest in the morning. Desires cold drinks, but cold aggravates the throat. Constipation for months. She had very chronic constipation. With the exception of the aggravation from cold, all features of the case were prominently Lachesis. It was predominantly Lachesis case. And Lachesis tenom was prescribed. The next, within 2 days, the throat pain on the left side was much worse and after first dose. Cold aggravation by cold water, burning sensation at night from inhaling cold air. Thirst constant for cold water. Bowels now normal. First time for months, the bowels became normal. Wakeful, hears, she couldn't sleep, she could hear the 10 o'clock, 11 o'clock, 3 o'clock, all that she was wakeful in the night. Had pulsating, cracking sensation at the base of the skull when turning head from side to side. The doctor prescribed just Saclac. All the throat symptoms ceased at the end of the week. Within 1 week, everything came down. The favorable action of the remedy was evidenced in the aggravation occurring on the first day and the improvement on rectal evacuations. The wisdom of continuing the same remedy was quite clear when the disorder of 6 weeks duration was entirely eradicated within 1 week. Here, friends, I would like to say one word. Many times we also, when we prescribe medicines, sometimes the aggravation within 2 days, 3 days, or 1 week, 2 days aggravation, we tend to change the medicine. So let us not do that. When we are sure that our medicine is correct, what we have selected is correct, let us give some time. And then the medicine starts working and you'll get the relief. Now you see in this case, though her presenting symptom, throat symptom were aggravated within 1 day, 2 days, but her chronic complaint, which she had the constipation, was better. And by the weekend, the entire patient became better. So we need patience. Patients will not have patience, but doctors, physicians like us should have patience for allowing the drug to act and get the result. Now this is second, I think time is, we have time. This is another case. A young man who, having studied too much, had become mentally diseased. Now, this is one very important point I would like to stress. Nowadays in India, this is in America, but today in India, the pressure on the students is so much they can become mentally mad. Because now only one thing is that you have to compete and get good marks and do nothing, just good marks and get some job. And in this competition, the children are not able to bear that and tolerate that. And they become mentally either irritable or depressive or angry and committing so many other things. And many people have done suicide. See, we have seen young children, because they couldn't score well, they committed suicide. 9th class girl, to 12th class boy, to PUC, they couldn't score good marks, so they commit suicide. All these things, when are there like this, a few doses of Lachesis can prevent this. So they can become extraordinary talkativeness, contrary to usual habits, because of mentally disturbed, because they want to hide their weakness, continually making speeches in the choicest language, but passing from one thing to other thing, which we see very commonly. Lachesis shifts from one topic to other topic, just like that, without even preparing. Talking about the most heterogeneous things was there in this patient. Towards those around him, he was full of distrust and haughtiness. So such case, he never trusted anybody and he was very angry. That case was cured by Lachesis. Now this is another case, fistula lacrimalis, cured in 2 weeks with 1 dose of Lachesis, which was accompanied by long-standing eruption on the face, which he had treated unsuccessfully for 1 year with other homeopathic remedies. So see, some patients can stick out to us for 1 year without getting relief. That's a great thing. But anyhow, Dr. Schellhammer had one case which he couldn't treat the eruptions. But this fistula lacrimalis, he prescribed Lachesis and the eruptions went away and this fistula also was cured. Now we'll take another case. A woman discovered a small black spot on the calf of her leg, which gave her great deal of uneasiness and it rapidly increased in size. When I saw her, she was in bed and the spot measured 3 inches in diameter. It was gangrene, rapidly increasing in size, and she grew sicker and sicker. Now, Lachesis was given, and in few hours, the progress of the disease was checked. Now, see, when such cases come, we think of arsenical, Sikalkar, and other things, and Lachesis also few remedies. But when the medicine is exactly similar, correct, the result we can see within minutes or hours. Now, see, within hours, that progress of gangrene was stopped. In few days, the entire piece of the flesh which was affected fell out, leaving a hole reaching to the sheath of the muscle. But this also healed in a short time. This was a case presented by Dr. Ner. Now, hemophilia. He has been bleeder since birth. Just before he was born, his mother had a tooth extract and the bleeding from the gum could not be stopped for a long time. Every scratch or little cut he had would keep on bleeding until he was almost exhausted and then the wound would heal. Had smallpox when a year old. At 12 years of age, he sustained a small cut on the forearm, the hemorrhage from which he could not be stopped. Suturing was attempted in Pennsylvania hospital, but this only increased the bleeding points. Was in the hospital for 5 weeks, and when he was bled out, the wound started healing. Fracture of right thigh bone and delayed union 8 weeks before any union was observed. Every slight bruise followed by extensive ecchymosis. Epistaxis continued for 3 to 4 days. Rheumatism for the past 2 years, since the development of which the bleedings have not been so troublesome. Now see, this rheumatism suppressed the bleeding tendency. Just before coming here, he has been in bed for 2 months suffering from inflammation of bowels, that is rectum and intestines, and hemorrhage till he was bled out. June 2, 1896. present symptoms: rheumatic pain in knees, elbows, can hardly stand, swelling of the knees, pale from bleeding, bleeding from gums constantly, small wounds bleed much. All these symptoms are leading towards the drug we are discussing. Small bruises makes him black and blue. Great thirst for water, just hydrant water satisfied. Means he wants to drink more water. Lachesis 41 m was given 1 dose. July 29, felt first fate until July 2nd. July 2nd dose. Rheumatism returned to elbows and left was first, left elbow. Lachesis 41, again 1 dose was given. August 22, improving constantly. December 7, stiffness in knees and elbows. Again, Lachesis 41 m was given. January 30, 1897, some stiffness was returning. Lachesis CM 1 dose was given. September 16, no symptoms. October 5, some bleeding, rheumatic swelling in right elbow, only lasted for a short time. Lachesis CM again repeated. December 15, bleeding again. After a year, Lachesis CM one more dose was given. March 19, 1898, bleeding again, rheumatic symptoms returning, stiffness in elbow, so Lachesis MM was given. July 16, only some stiffness in left elbow. Now you're seeing here, Lachesis was repeated so many times because it was indicated and it acted. And you will be surprised, 41M, 50, we have a very systematic way of potencies now. Earlier, they have prescribed 60M, 50M, 70M, 90M, all those things. After some time, they standardized 10M, 50M, CM, MM, etc. Now, this is one for information for all of us. We have essential hypertension cases. This research was conducted not by me, but somewhere else. This result indicated there was a decline in blood pressure in cases of essential hypertension patients. Treatment with Lachesis Nuta 30 has produced an early, sustained, and significant fall in BP, and it has also proven as a safe and effective in the treatment of essential hypertension. Therefore, Lachesis is a good choice as a specific remedy for regulating blood pressure in essential hypertensive patients. But here, friends, I would like to give a warning. If there are no other symptoms, if there is no other indication for no other drug, then you can try this as a specific for some time. But if the patient is calling for some other symptoms, please prescribe that medicine as a principle of homeopathy. See, I had a lot of experience with this in my Chandigarh life, where patients had, and we have tried, and it worked, but not in all patients. Now, this is one case, Dr. Khuda Baksh from Bengal, and it is maybe 8-9 years back. Erythematous skin on left foot, ankle, and part of calf muscle, throbbing sensation, tender, palpable, discrete, left inguinal lymph nodes, and he was having fever with throbbing headache. Belladonna 6C, 6 doses at an interval of 4 hours. Just 2 days, Pyrogen 200C was given, advised for Doppler and USG affected limb to exclude possibility of DVT. 11-8, inguinal lymph nodes have subsided, fever subsided, calf muscle edema decreased, burning, stinging pain in affected limb. Apis mellifica 200C, 2 doses. 12-885, report shows deep venous DVT was present in popliteal and posterior tibial veins. 13-8, stinging pain gone and other inflammatory features almost gone, inguinal lymph nodes no more palpable. 15-8, severe throbbing pain and bursting sensation returned, better by elevation of the limb. Vipra, again a steak medicine was given. 18-8, atrocious burning, markedly aggravating at night, much psychological restlessness, relief of burning pain with applying cold water. So he gave Lachesis 200. 21.8, burning sensation much better, no cough tenderness and edema, mind peaceful. 26.8, limb almost normal, can walk freely, can flex the limb. And 9.9, Doppler study normal, DVT. No medicine, the patient continued to be in good condition of limb since then today at regular follow-ups. Friends, now this case, and this I would like to say only one thing. Dr. Bakshi, Khudabaksh Bakshi prescribed so many medicines, and DVT dissolved maybe within 1 month or 15-20 days. Whether it is possible or not, I do not know, but because he has presented and we trust him, so it might have dissolved within 15-20 days or 1 month. And we have so many medicines changing. This also gives us an idea. If the symptoms are changing and the condition is worse, we need to change the medicines as and when the symptoms call for. So with this, I stop my presentation, and this is my, as usual, my phone number, my address, my email ID. Anybody wants to note down, they can note down, and they can ask any questions. We have 10 minutes or 7-8 minutes more with it. And if anybody wants to add anything, they can add to our lecture. Just I am getting out of my presentation. Yeah.
Yes, sir. It's really a big session about Lachesis, but all the slides as well as the videos you have shown since from the very beginning itself are really excellent, and
Thank you.
that really we never got such an idea about this Lachesis in any of our previous editions, but really. We are very happy to have such a wonderful procession from you, sir. Dr. Sridhara Kurupusar, Dr. Hubert, and are ready to ask. Let us begin the session
Please.
from Sridhara Kurupusar itself. Then we
Herbert, Dr. Herbert. சொல்லுங்க, எப்படி இருக்கீங்க? நல்லா இருக்கீங்களா? You
Yes.
unmute.
Sridhara Kurupusar is waiting, sir. Then
Sridhar Kurupusar പറയട്ടെ. Let him say.
Yes, sir. Your class was very fantastic, very excellent. Thank you very much. So it went into every part and nook and corner of the Lachesis, and presented, even though it is not your case, but others' case, it was very fantastic case.
So my way of thinking is, if anybody has a good case, let us share it.
Yes,
Let
yes,
us
I
learn
agree.
from this.
I'm not telling that,
Yeah.
that I'm not criticizing. I appreciate you.
Yeah.
And also you call same that you Hindi also that you called me, but that day I was not able to unmute because of that some problem in my computer.
Yeah.
Today I prepared, I was able to. I am very glad to meet you. Come again in our forum. Most
Yes,
welcome. Your all seminars are excellent, sir. A big salute for you. Thank you very much.
Thank you very much.
Okay.
Yes, Herbert.
Thank you,
End
sir.
of the
Thank you very much, sir. Very nice presentation. Very heart-touching. You are doing very wonderful classes, and it is like a film. We are seeing all this. Your way of talking, your presentation, and everything is good. But unfortunately, one thing I want to say.
Yeah.
Sir, while we are when we are putting this, uploading this YouTube for the these presentations, that time we cannot attach the copyrighted property of that films.
Yes,
we have to remove.
Yeah,
Otherwise,
remove it.
Otherwise, that is but the beauty of the presentation will go. So even though, so I want to say that everybody should attend the first day. Then only they can see the whole picture. Some parts we have to remove. That is what I want to say. It is very sorry to say that we have to remove that film part. Copyrighted property. These are copyrighted property. They will, if they are complaining anything, then we have to give money for them. We have to give. Sorry, sir. Thank you, sir. You are always welcome to our platform.
So nice.
Thank you, sir.
Anybody else?
Yes,
Dr. Hariharan has a prachana. Dr. Hariharan.
Yes, Dr. Rambaresh sir is the first.
Ram Paroj ji, Haji.
Thank you, sir. Thank you, everyone.
Very
Thank you,
परसों
Dr.
भी हमने देखा।
Patel sir ji. Congratulations. Very nice presentation. Excellent session.
Thank you.
Lachesis, sir, reveals the lot of Shiva, Krishna, Patanjali, or many kinds of symptoms like this.
Yeah.
Really excellent session. But Lachesis not deals in this time. Lachesis patient या Lachesis love this Lachesis symptom
Yeah.
love disappointment symptom, very nice symptom. Thank you, sir. Thank you. Very, very thanks.
Dr. Hariharan sir,
Now
you
it
want
is
to
up
ask some
to
question?
now it is up to Hariharan sir to say.
Dr. Hariharan sir?
Okay, sir. Okay, sir.
Yeah.
Sir, only nothing. I like to congratulate you for such a presentation.
Thank you. Thank you.
Only
Thank
thing.
you.
See,
Thank
one of the symptoms I like to add.
Yeah.
See,
Please add.
that is that the certain patients flick by the tip of the tongue at
Yeah.
the over the top of the lip. See, sometimes protrude the tongue, and that is a constitutional symptom of lachesis.
Yeah. Yeah. They can shift because of split of tongue. You can take it. They can shift it in the. They can be positive. They can be negative. They can talk on various things. Yes, we can all see. This is how we can easily remember the medicine. My idea of showing Shiva was only to remember the symptoms. So you can just whatever little bit you know, you can apply it and oh, he is like that. So all the
Okay.
symptoms.
Okay, to compare, and we can remember the medicine very easily.
Yeah.
See,
Yeah.
certain
That's
cardinal symptoms of lachesis, suspicious,
yeah.
loquacious. See,
Yes.
the suppression of discharges, ailments
Yes.
due to suppression of discharges. See,
Exactly.
these are the cardinal left side, and see, his lachesis is a hot patient, ameliorated by the cold things, things. And the asthma, but one of the other symptom I like to add. See, asthma's difficult respiration is ameliorated by distant fanning.
Yes. Yeah. This that symptom we told in the earlier part of my lecture. It was
Okay,
there.
sir. Okay, sir.
He wants blowing air from a distance, and I compared that with the carbovage also. Carbovage
Okay.
also has similar symptom. Carbovage and lachesis we can differentiate in the mild way, and both are cardiac remedies. Both are remedies to be given at the emergency times with the cardiac complaints, etc.
Okay,
Yeah.
sir. Okay, sir. It is the time to wind up the session. I invited Dr. Neha Kakkar to say what a thanks to this session.
Okay. Yeah, it was a really excellent session by Dr. Patel. I mean, nobody can imagine that how can you match the symptoms of lachesis with Lord Shiva. And it was a very auspicious occasion of Shivaratri today that we came to know about all these things. He provided a completely different insight into the picture of lachesis. So a very wonderful session, sir, and I would like to congratulate to him for that. And we can have many more snake remedies with him because he's providing a different insight on the same. So thank you very much, Dr. Patel.
Thank you.
It was a pleasure listening to your session, sir. Very informative session, sir. Thank you so much.
Thank you, Dr. Neha. And tomorrow we will have a session from Professor Dr. Gaurav Bhatt, and sir, he's the principal of Ahmedabad Homeopathic Medical College, and we'll be talking about sciatica and its homeopathic management. And
so, Shubharatri to everyone, and enjoy the life and listen the lecture. See, on Shivaratri also you are doing this program. I salute once again.
Yes, sir.
Ifph.
Yes, sir. That's why on the day of Shivaratri, on this night of Shivaratri, we have a wonderful lecture on Shiva, Lord Shiva and Lachesis. That is the direct typical drug picture presentation of Lachesis. Thank you thank you all for joining this evening, and with that we come to the end of the day 1285, and it is over to Dr. P. Shaila to moderate the Malayalam session. Thank you all. Good night.
Okay, thank you, Dr. Dhanesh. Thank you, Dr. Patel. All doctors in English section. Thank you. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ ഇടതടവില്ലാതെ തുടർന്നു വരുന്ന വെബ് പരമ്പരയുടെ 1285 ദിവസമാണ്. ഇന്ന് ഈ മലയാളം സെഷനിൽ ഒരു സ്പെഷ്യൽ പ്രോഗ്രാമാണ് നടക്കാൻ പോകുന്നത്. എല്ലാവർക്കും അറിയാം, ഇന്ന് ഇന്റർനാഷണൽ വുമൻസ് ഡേ, അന്താരാഷ്ട്ര വനിതാ ദിനമാണ്.